Hi, my name is Amy. Today I'm going to do a newborn assessment on baby Jack. First, I'm going to introduce myself to the parent and explain the procedure. I'm going to gather my supplies. I'm going to perform hand hygiene and provide privacy. I'm going to put gloves on. Uh, a little bit of information about baby Jack. He was born 8 hours ago. He was delivered vaginally. No complications. All right, first I'm gonna do general observation. First thing I'm gonna assess is the color. Baby Jack's color is pink. He is Caucasian. His posture is relaxed. There's flexion of the elbows. Knees are flexed, all within normal limits. Next, his proportion. Head and neck are approximately 1/4 of his body. That is normal. For movement, when I touch him, here, his movements are symmetric. Skin, I don't see any bruising, milia, birthmarks, or stork bites. Next, I'm going to do measurements. Baby Jack's birth weight was 3,373 grams. Normal newborn weight ranges from 2,500 to 4,000 grams. Next, I'm going to measure his length. Normal newborn length is from 48 to 53 centimeters. I'm going to measure from the bottom of his foot to the top of his head. All right, baby Jack's length is 50 centimeters, which is normal. Next, I'm going to measure his head circumference. Normal limit is 32 to 36 centimeters. I'm going to lift head slightly. I'm going to measure from the widest part of the back of the head all the way to just about the eyebrows. All right, baby Jack's head circumference is 34 centimeters. Next, I'm going to measure baby Jack's chest circumference. Normal range is 30.5 to 33 centimeters. I'm going to measure at the nipple line. All right, baby Jack's chest circumference is 31.5 centimeters. Next, I'm going to do or assess the respiratory. I'm going to count 1 full minute. I'm going to use my fingers to feel the respirations as the chest rise and fall. All right, that's 1 full minute. Baby Jack's respiratory rate is 48. Normal range for newborns is 30 to 60. Next, I'm going to assess baby Jack for respiratory distress. One sign or symptom is nasal flaring. Baby Jack does not have nasal flaring. Next is increased respirations. So we just measured or I just counted for 1 full minute for his respirations. It was 48, so it was within normal limits. Next is retraction. I'm gonna look at his ribs for retractions. It does not look like there's retractions. Next, another symptom, circumoral cyanosis. So I'm gonna check. It does not look like baby Jack has circumoral cyanosis. Another symptom is grunting. I do not hear baby Jack grunt. Next, another symptom of respiratory distress is asymmetrical chest expansion. So baby Jack's both of his chest, both sides of his chest are rising and falling at the same time. So his is symmetric chest expansion. All right. Next, I'm going to auscultate for lung sounds. I'm gonna need to use a pediatric stethoscope, or I have a regular stethoscope, but I also have the Bell, the other side, the smaller side, which is called the Bell. This is what I'm gonna use to auscultate for heart or lung sounds. The reason we're using a pediatric stethoscope is because baby is so tiny and organs are compacted together that if we use the regular side of the stethoscope, we are going to hear bowel sounds instead of heart or lung sounds. All right, I'm going to auscultate for breath sounds. I'm going to start on the right side. I'm also going to auscultate right here on the sides. Lung sounds are clear. So a vaginal delivery typically helps a newborn clear out most of the fluid in their lungs by squeezing through the birth canal, while a C-section delivery can leave more fluid in the lungs, potentially leading to respiratory complications. So baby Jack was born through vaginal birth. Next, we're going to assess cardiac. I'm going to count 1 full minute and auscultate for heart sounds. The normal range for heart rate for newborns is 120 to 160 beats per minute. Again, I'm going to use the pediatric side, the Bell, and I'm going to auscultate on the lateral side on the third or fourth intercostal space instead of the normal when we auscultate an adult, the left mid-clavicular line in the fifth intercostal space. So instead of that, we're gonna listen the lateral side in the third or fourth intercostal space. All right, that's 1 full minute. Baby Jack's heart rate is at 135. Next, I'm going to palpate or measure his brachial and femoral pulse. All right, Baby Jack's brachial pulse is also at 135, and 2 plus for strength. All right, now I'm going to measure the femoral pulse. All right, femoral pulse is equal on both sides with normal rhythm, about 135 for rate and 2 plus for strength. All within normal limits. All right, next for blood pressure. So the normal range for blood pressure for newborns is systolic 65 to 95 over diastolic of 30 to 60. So we're not going to take the blood pressure of a newborn unless there's any cardiac signs or problems, like pulses on each side that are not equal. That could indicate a cardiac problem or something else. So that's when we are going to check the newborn's blood pressure. Next, we're moving to the head. We're gonna assess the head. First, I'm going to assess the suture lines. So make sure it's not overlapping and that it's well approximated. There is this thing called caput succedaneum. It's a soft tissue swelling that crosses the suture line due to pressure during birth. Typically, it resolves within a few days. There's also this thing called cephalohematoma. This is a collection of blood between skull and periosteum, and that does not cross the suture line. This is common with prolonged labor or vacuum or forceps assisted birth. This may last for a few weeks and up to a few months. Next, I'm going to assess the fontanelles. There's two fontanelles, the anterior fontanelle and the posterior fontanelle. Anterior fontanelle is diamond in shape and larger. The posterior fontanelle is triangular in shape and they're smaller. So a normal fontanelle should be flat. A sunken fontanelle is a sign of dehydration, while bulging fontanelle is a sign of increased intracranial pressure or fluid buildup. Next, we're moving to the eyes. Baby's eyes is I'm sorry, let me look look for my pen light. All right, I'm sorry about that. Next, I'm going to assess baby Jack's eyes. So the color of his eyes are slate gray, which is normal. Sclera is white, no sign of jaundice. Next, I'm going to assess the pupils. Pupils are equal round. They are reactive to light. We cannot test for accommodation since they can't see far at all. Next, we are going to assess the ears. So the pinna, the top of the ear, should align with the outer canthus of the eye. So Jack's ears, pinna, and his canthus of the eye does align. Next, we're going to assess for preauricular skin tags around the ears. These are excess skin. So this could indicate renal malfunction. Baby Jack does not have periauricular skin tags. Next, I'm going to assess his nostrils. I'm going to assess for patency. I'm going to do that by closing the mouth and occluding the left nostril and feel the airflow coming out of the right nostril. Then I'm going to do that on the other side. So I'm going to keep the mouth closed. I'm going to occlude the right nostril. Then I'm going to feel the air coming out of the left nostril. So everything is normal there. Next, I'm moving to the mouth. So I'm going to assess for rooting reflex. I'm going to put my pinky in baby's mouth. Baby starts sucking. Baby Jack does have good rooting or sucking reflex. Next, assess for the mouth. The mouth is symmetrical. There's no sign of injury to facial nerve. Check for Epstein pearls. There is no Epstein pearls. If Epstein pearls are present, that is normal. And then I'm going to assess for circumoral cyanosis. Baby Jack does not have circumoral cyanosis. If baby has circumoral cyanosis, which increases with crying, this might indicate congenital heart defect. Next, I'm moving to the neck area. Neck is short with thick skin folds, no webbing or obvious fat pad, which is an abnormal finding. Head moves from side to side without resistance. Next, moving to the chest area and clavicle. A baby could break a clavicle during vaginal birth. So I'm going to take a finger and feel each side, both sides, the left side and the right side clavicle. A lump could indicate clavicle fracture. Baby Jack does not have lump. All right, I'm moving. Next, I'm going to assess for the chest shape. Baby Jack does have cylindrical chest shape, which is normal. 2 nipples present and located properly. Next, we're moving to the abdomen. Bowel sounds. I'm going to auscultate before I palpate. Again, I'm going to use the bell side. I'm going to start auscultating at the right lower quadrant. I'm going to move to the right upper quadrant and the left upper quadrant. Last is the left lower quadrant. Alright, since baby Jack was born 8 hours ago, I am able to hear bowel sounds because he has peristalsis. If baby was just born, absent bowel sound is normal. Now I'm going to palpate the abdomen. It is soft, round, and symmetrical. Now I'm going to assess the umbilical cord. Umbilical cord should have 2 arteries and 1 vein. It may or may not be able to be distinguished. It is bluish white in color. There is no lump or bulge. A lump or bulge could indicate umbilical hernia, and Baby Jack does not have a lump or bulge. Next, I'm going to assess the extremities, like Moro reflex. First, I'm gonna put my fingers in Baby Jack's hands. He's curl his hands around my finger. Then I'm going to slightly, gently lift him up while his head is still touching the bassinet. Then I'm going to let go and drop his arms. And we can see that his arms go out, fingers spread, and then they curl back. That means he's got good Moro reflex. Next, we are going to assess for hip dysplasia. So I'm going to flex his knees, and I'm going to abduct it equally. And I do not hear any clicking sounds. So flex and abduct, flex and abduct, no clicking sounds. Next, I'm going to assess for palmar reflex. I'm going to put my finger in Baby Jack's hand. He curled up his whole hand around my finger, which is good. It means he has good palmar reflex. Now I'm going to assess his creases in his hand. There's this thing called simian crease, which is a single line that runs across the palm of the hand, which is an abnormal finding. Baby Jack have 2 transverse palm creases, which is normal. Now I'm going to check for his ankles and feet. His feet does not have any extra digits or webbing. Now I'm going to do the plantar grasp. I'm going to put my finger around on his bottom of the feet and his toes curled up, which means he's got good plantar reflex. Next, I'm going to do the Babinski reflex. I'm going to stroke the lateral side of his foot, bottom of his foot. We can see his feet flares up and the great toe dorsiflexes. Next, I'm going to assess his back, the posterior side. I'm going to lift him up slowly, support his neck. So, his back is straight and flat, no abnormalities. I'm checking if there are tufts of hair, which can indicate spina bifida occulta. I'm looking at the sacrum for any dimpling, which could indicate pilonidal cyst. Next, I'm looking at the buttocks and gluteal folds. They look symmetric. Legs look symmetric in length, and that's normal. Next, I'm looking at the anus. Make sure he does have anus and there's no closure or fissures. I'm going to put him, and also there's no Mongolian spots on his buttocks. All right, now I'm going to put him back. I'm going to assess the genital area. If the newborn is a female, typically the labias are swollen, vernix may be present in folds, may have small vaginal discharge or bleeding due to maternal hormones. Since Jack is male, I'm gonna assess and palpate his scrotum. So scrotum bilateral with testes intact, no epispadias or hypospadias, no fissures over the anus. All right, then I'm gonna clean up the baby. I'm gonna make sure the baby is nice and warm. I'm gonna swaddle the baby. All right, next I'm going to give the baby back to his mom. Then I'm gonna check on mom and see if she has any questions or if she needs anything. If not, I'm going to perform hand hygiene and put call bell within reach. Thank you.